Hi, my name is Marie Morris and I am the Hospital Link Worker with PKAVS. My role is funded through the Health and Social Care Partnership and is primarily based within the Social Work Hospital Discharge Team in Perth Royal Infirmary. Link working is designed to ensure a fully holistic support service to both patients and their carers. This can help to support a safer discharge for the patient and to prevent readmissions. So the roles and aims of the Hospital Link Worker. The main aims of the role include ensuring unpaid carers are included in the hospital discharge process for their cared for person who will be currently an inpatient in one of the hospital sites within Perth and Kinross. To identify unpaid carers within a hospital setting and then offer information, support and advice. To signpost carers to relevant support services when the cared for person leaves hospital to ensure continued support. Under the Carers Act Scotland 2016, unpaid carers have the right to be included in the discharge process. Carers should be told as soon as possible when their cared for person is intended to be discharged and invite their views about the discharge. Carers should then be able to voice any concerns they have and their views should be taken into account. Carers need to be identified without delay, particularly where the patient will need care following discharge. So who is an unpaid carer? A carer is anyone who cares unpaid for a friend, a family member, a neighbour who due to illness, disability, a mental health problem or addiction cannot cope without their support. Unpaid carers can be as young as 5, known as a young carer, and as old as 99 or over. A carer does not need to be living with the person they care for. Women are more likely to be carers than men, and people in their 40s and 50s are most likely to be doing a caring role. So how does caring affect someone's life? Caring can affect many aspects of life. Health and well-being. Caring can cause both physical and mental exhaustion by being up overnight, lifting someone heavier than them, being stressed and anxious. Relationships. Many carers find the dynamics of the relationship with the cared for person changes, particularly with the diagnosis of conditions such as dementia, multiple sclerosis, motor neuron disease and stroke. Finances. Caring can lead to poverty as many carers have to give up work or live on benefits. Intensive levels of caring are most common in deprived areas. Around 270,000 people combine caring and working. That equates to 1 in 8 people in the workforce. This number will likely grow as people continue to live longer, on average 20 years longer than a few decades ago. Life balance can be affected. Many carers put the other person's needs before their own and can struggle to get to their own appointments for a simple haircut or a coffee with friends. The caring environment. Many carers find that having specialised equipment in the home or paid carers coming in and out is disruptive and intrusive to their lives. Learning. Many carers find it difficult to keep up with school, college, university, or to take part in a hobby or interest. So who can refer to the Hospital Link Worker? Anyone involved in the patient's care. Nursing staff, occupational therapy, physiotherapy, speech and language, psychiatry of old age, dietitians, social work, and the carer can also self-refer. It is everyone's responsibility to ensure that unpaid carers are supported. So how can you refer a carer to the Hospital Link Worker? Referrals can be done in a number of ways. Staff can contact the Hospital Link Worker, Marie, directly by either emailing or phoning and passing on the carer's details. If a social worker is involved with the patient, they can speak to the carer and ask if they wish to be referred. There will be new hospital link worker leaflets within all Perth and Kinross hospital sites, which carers can be given or they can pick up. Details of how to contact a hospital link worker and self-refer are in these leaflets.